Hello guys, welcome to my channel. For those of you who don't know me, my name is Sol, and those of you who do, welcome back. In today's video, I wanted to answer a few questions that you've asked me about my studies abroad. So if you're interested, please keep watching and make sure you give this video a thumbs up and that you subscribe for more videos from me. So for those of you who don't know, I studied dentistry as a mature student in Latvia, which is in Europe. It's near the Baltic Sea, and I studied in Riga, which is the capital of Latvia. So a little background about Latvia. So it's absolutely beautiful. It has the 4 seasons in the sense that you see a perfect color change this time of the year. So you see autumn, you see the leaves changing color, you see snow, a lot of snow. The temperatures are freezing in winters, so very different to what I'm used to or I was used to. Spring is beautiful. You can see the ice melting, the snow melting. It's gorgeous. You can see the flowers blossoming. And the summer is hot, hot, hot. A random fact for you, the Latvian women are the tallest women in Europe. My only random fact. And so the population when I started was a little over 2 million. It didn't have a very large international community. However, over the years, this did increase. So there was a lot more internationals and a lot more of people from different backgrounds, so Asians, blacks, a lot more than there was previously. I remember when I first went to Latvia, there weren't a lot of people from my background. So I used to have jet black hair, and once on the bus, someone kept stroking my hair, like literally just stroking my hair, because he'd never seen someone of my complexion before. I didn't speak any Latvian before I moved to Latvia. I didn't speak any Russian, so the two languages spoken in Latvia are Latvian and Russian. So I don't speak any Latvian, I don't speak any Russian. I didn't know much about Latvia, if I'm being honest with you. And I learned quite a bit when I went there, so it was lovely. So the course was taught in English. I got a DDS, which is Doctor of Dental Surgery. I think in the UK most of the universities provide a BDS, which is a Bachelor of Dental Surgery. And so what are my thoughts about the university? So in comparison to a few of the universities that I visited on study days here, I have to say that the Latvian university was very new, very up to date in terms of the equipment they had, in terms of the chairs that we had, in terms of the scanners that we had. So in terms of my course mates, in my class I had a gentleman from Finland, one from Holland, 2 Swedish, and 3 from Great Britain, 1 from Ireland, and then myself and another gentleman from Liverpool. So it was a mixture. There, in the other classes, they had a lot of Scandinavians, a lot of Germans, and a few. So for dentist, this was more dentistry. For medicine, because it was a medical and dental school, for medicine there were a lot of German students and a lot of Portuguese students, a lot of Scandinavian students, and some British students. So a good mixture of people, which is fantastic because you get to learn about all these different cultures and they all come together really nicely. So a lot of the people I met initially when we first started the course were 18, 19-year-olds. And they were 18, 19 straight out of school, you know. So, but I have to admit, I was nothing like them at their age. They are fantastic. They were so mature for their age. Just amazing, beautiful people to be around. I learned a lot from them in every sense of the word. Very, very mature. Just there's a real sense of community within the international society, so everyone really mixed together. The weekends, there were events that were organized by the international community, so you knew where everyone was. Even though there was a large group of you, it was still very small. So it was like even though it was a city, it was like a little village, if that makes any sense. In terms of school, so it was taught in English. The lectures, in terms of lecture material, the lectures, I have to admit, they were not great quality. It was a lot of Google Translate when I first started. So not all the lectures were of great quality. I had to use some of my friends' lectures that were in the UK. So you have to do a lot of your own studies. So that was not great. But the lecturers really did go out of their way to help you. So if you needed extra time with anything, if you needed more teaching material that guide you, if you needed more time to prepare a crown, if you needed more time to do an endo, they would meet you in their own time and they'd go through it. If you were eager to learn, they were eager to spend their time with you. So that was really nice. And all you had to do in exchange was to speak English with them. And for them, that was really nice because they could improve on their English speaking, so on their English language. So I used to spend some time in the lab. So even the lab technicians would go way out of their way to help you. So I used to spend some time in the labs after school just to see what they did. On Saturdays, I would go into the oral surgery department and I would assist with extractions. I saw and assisted a sinus lift. So there's a lot of opportunity there. You just have to put yourself out there. You have to ask them, can I come in afterwards to shadow you? And they're all really eager to help you. What I struggled with a lot was the language. I did not pick up the language, unfortunately. All I could say is, please you open your mouth and are you in pain? The majority of our patients did speak English, which was fantastic. The ones that didn't, you relied a lot on your body language or on the dental, the nurses or the assistants there. But your bedside manner really improved because of it. Because to get the patient's compliance, you no longer relied on your words. It was purely your body language and how you acted as a health professional. So that was fantastic. So it wasn't all a bed of roses. The university, because it's a private university, because you're international students who are paying international fees, sometimes one could get the impression that they wouldn't mind you not passing, not progressing. So everything that I had to keep in paper form. If someone was to say something about an exam date, I wanted it in written form. So you had to be quite careful in that sense. The complaint procedure is very different to the UK. I find that in the UK they're firm but fair. Maybe in Latvia they're more firm, if that makes any sense. And that caused a lot of anxiety, not just for myself but for other students as well. So you had to be quite careful with that. So coming back to the UK now, I obviously got my degree in Latvia. I was very lucky and I did pretty well. And I got a job as a dental foundation trainer and got my NHS performers number. I did a dental core training, so that was in pediatrics and adult special care. And now I'm doing a dental core training in Max Fax. So I've been pretty lucky in how I've progressed. I don't feel that I'm at a disadvantage because I studied abroad. However, I do think that other people bring it up. So even in my appraisals, I've had, even though she studied in Latvia, even though she had studied abroad, she has done fantastically. So I think for some people that's a negative, whereas for me, I think it's fantastic. I managed to experience living abroad. I've managed to experience living abroad with a community of people who were also in the same boat as me. It brought us a lot closer together. There was a sense of unity. There wasn't that competitiveness that I've noticed with maybe a few of the UK graduates. So I thought that was really nice. And you got to experience living amongst other people, learning about their culture. So not only did I learn about the Latvian way of life, but I learned how the Germans do it. I learned more about the Portuguese, more about the Scandinavians, and it's brilliant. I've got friends across the world as a result of this. So it's great. I have to highlight that there was some racism towards the international community. However, this wasn't by the majority of the population. This is just by a small number of ignorant people. So it's not the majority of the Latvians there that are racist. They're not. It's just a very small number of people. A few people I know were caught up in this. I myself experienced it. So it's not a topic I want to touch on. It wasn't nice in that sense. Guys, the idea of studying abroad is very romantic and it sounds very nice, and I think people underestimate how hard you have to work as an international student. The workload is a lot. We had to learn the entire anatomy of the body in Latin, everything in Latin. The anatomy of the entire body. I think in the UK, is it thorax and up? But I'm talking like dentists having to know the feet. So a lot of it just does go into your short-term memory. We had to do histology, just a lot of different things. So the workload is a lot. You get homesick. I got very, very homesick initially, So you do get homesick. However, there's a large community of you. You're meeting people continuously because they're available to meet you, They're away from their home. You're all in the same boat, all of you. So that sense of community is beautiful. It's like no other. And that kind of stays for quite a long while. You do make friends for life, which is fantastic. So that's great. There are a lot of house parties because the weather is so cold in Latvia during the winter months. You do spend a lot of time at home, at each other's homes. So a lot of house parties, a lot of socializing, a lot of mingling, a lot of time in the library. It's just fantastic. It's really nice. I don't know if it's because I've been away from it for so long that it appeals to me again. But no, it was by far one of the nicest period of my life, and it was great to do it. You do get lonely, so I got very lonely. Even though I had Sina, my sister, there with me, I did get lonely quite a bit. And there was a large age gap between myself and the other pupils. However, again, they're very mature for their age. An 18-year-old who is living in a different country by herself is very different to an 18-year-old living at home, You've got so many other responsibilities, having to connect the internet in a different language at your home, paying for water bill, gas bill, even signing a contract with your house, for your house, looking for a house. Everything is a lot harder. So my course mates were very mature. Would I recommend it? Yes, definitely would recommend it. Would I do it again? I think now that I've done it, I would do it, but there are times when you're in it where you do not see the light at the end of the tunnel, you know. You're homesick, you go to school and it's dark, and you come home and it's dark and it's cold, and you miss PG tips, and you miss turning the TV on and for it to be in English, or picking a sandwich up at a petrol station and knowing what you're getting, you know. Is it chicken? Is it beef? Is it vegetarian? The language was really an issue for me, but that's just because of my poor language skills. But I definitely recommend it. Do it. You only live once. If your dream is to study dentistry, medicine, and if you didn't manage to get a place in the UK, go for it. Go for it. But don't think it's going to be easy. It's going to need a lot of dedication and a lot of hard work. And there'll be 9 times in the day where you'd want to quit, but then 10 times where you wouldn't. But so go for it. Honestly, I've done it, and I did it as a mature student, and I think it was the best thing I ever did for myself. So if you have any questions, guys, please feel free to write them down in the comments, and I'll answer them as honestly as I possibly can. And I hope you've liked this video. If you have, make sure you give this video a thumbs up, and please subscribe for more videos from me. Bye.